Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Having set the anterior teeth, we are now ready to begin the arrangement of the posterior teeth. The incisal pin has been removed for demonstration only, with the posterior bite rims maintaining the occlusal vertical dimension. The condylar mechanisms have been locked. For the proper placement of mandibular posterior teeth, it is necessary to draw lines on the boxing edge of the master cast in order to visualize the stress-bearing area. On this technique exercise, the stress-bearing area coincides with the crest of the mandibular residual ridge. As previously described, it is necessary to remove the wax occlusal rim from one side to facilitate the setting of the denture teeth. The wax occlusal rim on the opposite side, as well as the incisal pin, maintains the occlusal vertical dimension. A thin softened strip of pink base plate wax is now added and sealed to the base plate in preparation for setting the posterior teeth. The mandibular bicuspids are placed into the softened base plate wax according to the following requirements. 1. The central sulci should coincide with the reference lines previously drawn on the master cast. 2. The long axis of the posterior teeth should be perpendicular to the occlusal bite rim. 3. The height of the tooth is such that the cusp tips should be even with the occlusal bite rims. These requirements can be verified by sighting down and across the setup. After placed properly, the teeth are sealed to the base plate. The maxillary first bicuspid is now set into soft base plate wax after the maxillary wax rim has been removed. With this technique tooth, the cervical neck of the maxillary first bicuspid is prominent. Its position is determined by proper intercuspation with its mandibular antagonist. Proper placement will result in the long axis of the tooth being vertical and its lingual cusp supported by the fossa between the mandibular bicuspids. Proper setting of a tooth may be verified by sighting from the lingual aspect. The maxillary lingual cusp should be in positive contact with the mandibular fossa. The mandibular first molar is placed in softened wax. Its cusp tips are placed at the tentative plane of occlusion. The long axis of the tooth remains perpendicular. The central sulcus is placed in harmony with the bicuspids and the established reference points. The mandibular second molar is set similarly. Notice again that the central grooves of the mandibular posterior teeth are in line with the established reference points, which places these teeth over the primary stress-bearing area. The marginal ridges of adjacent teeth are at the same level. After proper placement, the teeth are sealed to the base plate. The maxillary second bicuspid is set in softened wax in a manner similar to the first bicuspid. Its position is determined by intercuspation with its mandibular antagonist. The long axis of this tooth is perpendicular to the plane of occlusion. Notice that the horizontal overlap is developed when the maxillary lingual cusps seat in the mandibular fossa. Again, notice that the proper intercuspation of this tooth can be seen only from the lingual. The maxillary first molar is set in soft wax and is in alignment with the maxillary bicuspids. Its proper position is also determined by its intercuspation with its mandibular antagonist. The long axis of the tooth is perpendicular to the occlusal plane. The buccal horizontal overlap is developed in this setup. Buccal overjet results in proper articulation and prevents cheek biting in the clinical application. The maxillary second molar is set similarly. Care must always be taken to keep wax off the anatomical portions of the replacement teeth. A number 7 spatula can be used from the lingual aspect to carefully adjust the teeth so that the maxillary lingual cusps interdigitate with their antagonists. Please remember that the incisal pin was removed only for demonstration and that its purpose is to maintain the occlusal vertical dimension. The posterior teeth on the opposite side can next be set. The resulting first denture setup with the teeth set in centric occlusion is illustrated.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.